Hello, everybody. How are you? Um, I'm Dr. Yongkuho. Very nice to see you here, and I'm very happy to introduce the SmileArch made by the biotech. The SmileArch is for determining vertical dimension and the CR record, and also the SmileArch, smile line, and so it's good for making oral necks or full arch cases. So I'd like to share our information to you guys. So it's very helpful to you to introduce this SmileArch to our next symposium. So as you see here, the SmileArch I will show introduce later. So basically, this is determining vertical dimension, as you see here. So there are many ways to determine vertical dimension, but this is one way to determine vertical dimension. And also, if you can see here, we can determine or verify the smile line aesthetic in front of the patient. So as you see here, if there's a patient, and after we placing implant, so we'll see this kind of situation. So how can we fabricate provisional restoration at the same day? So we need vertical dimension and also the CR record in vertical dimension of occlusion. And also we have to conform the vertical aesthetic from the patient. And also after we place implant, we need accurate intraoral scanning, as you see here. But I want to get all this information at the same day to get the provisional restoration. So how we can fabricate provisional restoration at the same day? So I'd like to say about vertical dimension and CR record and aesthetic confirmation at the same time. So there are many ways to determine vertical dimension of occlusion. We can utilize the old denture. There's a vertical dimension there. And also, if there is a dentition, so we can measure the vertical dimension of occlusion. And also, if there's no information at all, so we can use the rest position. So 2 to 4 millimeters shorter than vertical dimension of rest position. And also, one of the way to using to determine the vertical dimension is you can use the golden proportion. But I want to focus on the golden proportion here. So as you know, the Lombardi in 1973, he introduced the golden proportion of the human body and also the golden proportion of the face. So you can see here we can utilize the interpupillary line and also the subnasal point, and also the mandible or the border, the inferior border of the mandible. So there's a golden proportion from here and here and here. So as you see here, so we want to utilize the ABCD point. A is interpupillary line here. Okay, there is the tail of the eye. Okay, so this is we call this A point, IP point. The B point is subnasal point this is the just underneath the nose, so we call this subnasal point. And also the C is inside the edge, and there's a D. So there's a golden proportion among these points. So we did the study on that golden proportion of the face. So we realized that we can utilize that kind of golden proportion to determine vertical dimension and also the smile line. So I determined I made that kind of very magic device to determine the kind of information called SmileArch M. It look like this. So first of all, with using this device to attach to the face. So we position this P point to the patient subnasal point. So there is a seat there. Don't push too much up. Don't position too much low. But just in the middle of this, very natural position here. So we're using this point as a reference point. So if we put here, there's a point here, a point, you see here. So there are interpupillary line. So this is a standard. So when you approach this to the patient, so we can see the difference from the standard to the patients. So for me, exactly matching this standard A point to my interpupillary line here. So if the interpupillary line is 1 millimeter or one line up like this, okay. So from this information, we can determine this vertical dimension of occlusion. So we call this D point here. So as you see, so we call this main bar from the SmileArch. So there's a A point, there's a B point, there's a C point, and there's a D point. So if we put this to the patient, the subnasal point, so we can see the interpupillary line. This is the standard A point. So what's the difference between them? So if there's a as you see here, this is 1 millimeter above the standard line. So then we can go to D point. There's a line. There's a lines 1, 2, 3, 4, 5, and also upper line 1, 2, 3, 4. So if there's 1 millimeter above the standard line A point, so we determine the line below the line is the D point. The D point here. So 1 millimeter, okay, 1 millimeter below the line. This is the D line, which means vertical dimension of occlusion. So like this. So we can determine the vertical dimension based on this AP the distance. So and also And there's a teeth. There's a teeth align the 10 teeth aligned there, so we can attach to this device and then put them to the patient mouth, and then we can adjust the inside the line. As you see there, there's a inside the line. So we can determine the face. I mean the smile line, and we can discuss to the patient with the patient, and we can decide the incisor line of the teeth. So from the anterior to the posterior, and also we can change, we can modify the position of the anterior position of the teeth. Okay, and also with this device, and we can decide the occlusal table, occlusal plane, according to this albatross line. So we can change the occlusal plane, right, from here. So you can see the patient. There's one upper edentulous arch. So we took the photo like this, an X-ray. We can plan to place 6 implants. We scan the edentulous ridge in the mouth. Okay, the first, and we applied this SmileArch M to the patient. It don't have to be very accurate position, which is, we can tilt like this, it's not a very important thing. Okay, we just approach the patient face, and you see there's a tray, upper tray, to make an impression, okay, with the putty or regular body or heavy body, okay, in that position first. And you see here, let the patient decide the smile line, okay, how much is showing the teeth. So this is the big advantage of this SmileArch M. You see here. So we decide the position of the incisor teeth first at the same day, and also we can take a CR record. CR because we already know the vertical dimension. Okay, we can get the CR record in the vertical dimension. And also we have to take the face scanning, and sometimes we can take just photo, just front photo and the side photo, okay, smile photo, and also we can take the CT scan with the SmileArch. So from this action, we can get this information, the upper and lower arch, and also with the bite registration, because we scan this impression intraorally. No, I mean with intraoral scanner or extraoral scanner. Okay, so we can get all this information from that, so that we can get mount upper and lower arch in the computer. So this is the purpose our purpose of doing these things. So we all matching all information from face scan data and to the SmileArch scan data. From this, we can see everything in the computer, like this, smile line, into the occlusal line, occlusal table, midline, vertical dimensions, everything. And also you can check everything is correct proportion or golden proportion or not. And also we can move the mandible from the computer, because there is a articulator, virtual articulator. We can modify the vertical dimension. From all this information, we can design the provisional prosthetics in a very quick time. Like it takes about 30 minutes to design the provisional restoration. From this information, we can planning the implants in each way. Everybody knows that. And so the surgery is ready. So we do the surgery with this surgical guide. I was using LXIT and in the upper teeth. We placed 6 implants. This, because I need some bone reduction, so I had to open the flap, and then we close the soft tissue suture and connecting the smallest skin body. As you see here, I will explain later in detail. So this is the after scan of this implant, and also we get the soft tissue scanning. So we're matching together. So the question is, how can we obtain the CR record in the right video, in the right video at the same visit after intraoral scanning? So it's very difficult to scan after the surgery, because there's a lot of blood and unstable soft tissue. So this is the most difficult part to mount upper and lower arch after the scan this data. This is a very difficult situation. There are many ways to get into occlusal bite restoration. So many people using the analog bite restoration, but it takes time. And also we can use a digital bite jig. So this is a lot of work. And also we can use some kind of scan body and pillars, and scan and ensure the bite restoration. But sometimes this is not good accurate. I mean, it's perfectly accurate. It isn't perfectly accurate. So even though there are many ways, but still it's not accurate. So we are suffering, to get very accurate occlusion. And also there are another method matching the iOS, the original intraoral scan data, and after surgery, so we get another intraoral scanning. but it's very difficult to matching together. Okay, so there are another way to put the additional implant in the maxillary palate area and in this upper arch, and scan this whole arch with this scan body. And then after with surgery, we put this on the same scan body in the palate, and we scan all together so that we can matching together. So this is, I think, this is one of the good way to matching together. But if we're using this SmileArch M, this is original impression. We can modify, we can alter the impression and relining in the mouth over the implants, so that we can match both together. And also we can confirm again the smile line, vertical dimension, and CR record. Everything we can do it again to get the very accurate information. So this is SmileArch impression, okay, and the bite, and we scan this SmileArch data, and also we do the intraoral scanning, okay, all together. Then we can mount these two upper and lower arch in the computer. And we have a right vertical dimension, and we have a right smile line. We have everything, so that we can design the final prosthesis or provisional prosthesis design. So we can finish the final restoration. Okay, this is final prosthesis design. Okay, framework. Okay, we can print or milling this metal framework, and we made the individual crowns or cemented all together. So this is the final prosthesis ready. Okay, and this 5 days later, implant surgery, and after implant surgery, so 5 days later, the final full arch prosthesis is ready. So we can deliver this final prosthesis in the mouth. Like this. So this is before and after 5 days. We can deliver final restoration like this. So this is the magic for we want to faster delivery of the not only provisional but also the final oral restoration as soon as possible. So we finished this case in 5 days. And 2 weeks later, everything's perfect. Another one is how to get the accurate intraoral scanning after the surgery. As you know, it's very difficult job. Obviously, this is not good way to make an intraoral scanning using this regular scan body. There are a lot of distortion. So we developed a very special intraoral scan body. We call the SmileArch scan body. For example, You see here, we put this scan post first under the MUA, okay, and then after the scan post, we put the scan bar on top of that and screw in, and tighten with the hex screw, okay, and we scan it. The following the scan bar will determine the individual implant position, like this. The main idea is the scanning for arch, because we're using this bar, it acts as a bridge, so that we minimize the distortion of this scanning. So once we determine the implant position, it change the color from the gray to the green. Okay. So you can align many way like this, so that we can put all together in the middle, so that we shot including everything, and then we go to individual implant like this, yes. Okay, and this is the scan post. Is different type of the scan post. It fit in the MUA, and also it can fit in the implant itself, like bone level implant, level battery IS fixture, and also the tissue level implant, which is IT. So we have on different type of scan post. But on top of that, everything is same. So this scan bar is fit to all kind of scan post. So we have the SmileArch scan by the kits. So I'm gonna hands-on on it. Okay. As you see, this is clinical case upper 6 implant. We put the post, okay, scan post, maybe on the implant itself or multi-unit abutment. So this is the look like the scan body kit look like. So we have the scan different lengths of the scan bar. Okay, the short, medium, long, and we have a different type of scan post. You see here. Okay, so we scan in the middle first, and then go to individual implants, just following this scan bar. Okay, so you can see the change in the color of the implant. So we already scan all implant position, and after that we remove the scan bar, and it look like this. Okay, we need another scanning of the soft tissue around here. So once you detach the scan bar, you can match the soft tissue and then scan the rest of the soft tissue like this. So we have two data, implant position data and also soft tissue data, and we match together, and we'll get this upper and lower for arch, which is a very accurate intraoral scan data. So as you know, there are another way to scan all these for arch with this shining 3D scanner, which indicated, one of the best intraoral scanner in the world, which is very accurate. So I want to make a very accurate scan body, comparing to the shining 3D scanner. So we got a little study comparing with this shining 3D scanner. We're using the Merit and SmileArch scan body. Okay? So we study on that and analyze. Finally, we got this result. This is maximum error from shining 3D. This is maximum error of SmileArch scan body. And it's come out quite good, quite same result. Quite accurate, like shining 3D. So we are very proud of using this scan body, SmileArch scan body. Thanks to the Merit i900, they made a SmartX program, but we can use other scanner like prime scanner, and also the 3Shape. So all of them are very accurate. This is the one another case. We're planning with Blue Sky Bio. The 4 implants on the lower. So we made the base framework, and also the stackable surgical guide on top of that. This is before extracted and connect the base bone reduction guide framework first, and reduct the bone, and placing this stackable surgical guide, and placing the ALX implants 4. Okay, we align this provisional restoration on top of the stackable guide. This is the angle and the straight MUA. This is ready for relying this provisional restoration. Everybody knows this technique. There's nothing special. This is regular procedure to reline the provisional restoration. So this is the provisional restoration is completed, but it takes time, like at the 2 hours or 3 hours to relining this provisional restoration. So after we delivered provisional restoration like that, the day of surgery, 1.5 months later, we scan the reverse scan of the provisional, so that we can make the lower the definitive arch restoration. So we're using this full monolithic zirconia without the framework. So, there are many ways to design this full arch monolithic zirconia, but it's easy to break. So we have to be very careful to design this kind of. It should be very bulky, okay, and it should be very accurate. So on top of these MUAs, we just screw down so that we can finish this case. So this is the regular procedure to do to the one arch and full arch case. Okay, I'll show one more case, to show how to scan the intraorally after the surgery. Okay, so this is the patient. So at the same day, we place the upper and lower implants, everything after extract this all teeth. So we need bone reduction and also extract all the teeth and problematic implants, everything's. Okay, although we made a surgical guide, but sometimes we threw it away. We don't using this surgical guide. Just extract the teeth and drilling and placing, and also we reduct all bones as needed, so we can finish 6 implant placement upper first, and go to the mandible, extract all teeth and bone reduct it, and placing the 4 implants, which is ALX and angled MUA, like this. So from the left side, the same day, we can place that kind of implants a situation. We need to solve all everything to give him provisional restoration or final restoration, right? So we need that kind of vertical dimension and also CR record, and the aesthetics, and impression or intraoral scanning. So we're using this SmileArch. So we made the impression on top of the upper arch first, according to that SmileArch information. Okay. So we verify, conform the smile line and occlusal plane from the patient face. And also we can determine the right video from the SmileArch. So I already explained everything. The one more thing, how to determine the CR record in the vertical dimension at the same time, because it's a very, very important procedure, and to get the right CR record. So we developed the idea to make the very, very accurate CR record. So we're using the Gothic arch system on the in the SmileArch. So we developed this kind of Gothic arch pin and bar, okay, so that we can attach this bar to the implant on top of the scan post, okay. So we can move this go the arch. We can change the height and the angulation. So we can match this point at the right video, because we know already the right video. We can change the vertical dimension. So there is some screw here, so we can change the vertical dimension. So once we get, let the patient move from the posterior to the anterior or side by side, and we'll get this arrow point. So this is the CR, very exact CR point, so that we can position this mandible to this point, and we get right CR record here. So we get smile aesthetics, okay, conformed, and also we get the information, the occlusal plane inside the edge, and also right vertical dimension, and also CR record. We take the face scan, okay, from here, smile. We're matching everything together, okay. Intraoral scanning data, also the smile data. We're matching everything together, and also invading this virtual articulator. So we determine the mandible, condyle position, so that we can move the mandible up and low, or we can change a little bit the vertical dimension. So end up we'll get this kind of buttress mounting. Then it's easy to design the prosthetic part. So this is the final prosthetic design, which can mill the PMMA, retain provisional. Then we'll get the soft tissue a little bit, and the same day or one day after, we can deliver the retain provisional restoration, which means we don't rely on this provisional restoration in the mouth. We just printed this provisional or mail the provisional and put in the mouth as soon as possible, like one day after or 2 days after. So this is the provisional 1 month. Now we can still also we can do the same procedure again to make the final restoration. We can scan again, with the scan bar, matching to the MUA, matching IS. So from this IT implants, we put this post again. 저기 왜 시간이 저렇게 된 거냐? 시간은 지금 가는 거냐 안 가는 거냐? 사실 몇 분 지난 거야? 내가 안 보이니까. So on the lower again, you can connect the scan bars on top of the scan post like this, and scan. So it's very easy to get a very accurate scan data. using this scan SmileArch scan body. Okay, the write record and the share record in the web video. So this is the final. Okay, same. I like to make monolithic zirconia full arch prosthesis, but there are many ways. Bar attached full arch. Well, this is actually monolithic. It should be very, very accurate fit. Otherwise, this bridge can be break. But this is a new system Neobiotic developed, which called CL link, which means cementless link for multiple system. We just put this CL link in the prosthesis without cement. Okay, we just tightening this. So this is look like the CL link look like. Okay. Okay, this final restoration is ready. We put the non-octacial link, the final restoration. Set into the mouth and just tightening. We check the fit. So this is the final. So we try to make the full arch or RNS cases in each way. Especially we want to save the time. We shorten the time, to give the not only provisional but also final restoration in a very, very accurate way as soon as possible. All right. So now I like to just show the hands-on. Okay, a little bit. I want to show to let you understand easily what is the SmileArch ham is. This is a vertical bar. We can call this beam bar also. There's a B, C, D point. Okay. This is the pupillary line. This is the subnasal seat. This is the inside edge. This is the vertical dimension. And we can put this face bow major point, okay, like this. And we can see this line, okay, this is the interpupillary line here. There's a tail of the eyes. Okay, this is the line. If we put here, okay, so we can see just the same level. We can see what's the difference from the standard A point to the patient IP point. Okay, so in this case, maybe almost same. Okay, same. So that means this vertical dimension should be the the standard line like this, or just if you 1 millimeter longer upper line here, okay, there's one point upper, then we go to 1 point lower. All right, and also this is D bar. So we can just using this point, okay, we can move, but actually this is the right golden proportion of the mandible position, VDO position. Okay, so we can use this as a standard, okay, as a reference. And also you can You can see all the patient mouth. You can determine the vertical dimension by yourself, but this information you can use as a reference. All right. And also, this is the smile smile line. Okay, beside a plate. All right. You can put this C point. Okay. If the 1 millimeter, okay, the same standard, you can put this line to the matching to this. All right, like this, and then you can put it like this. Then there's here, there's a bite tray, okay, by tray, but there's a teeth aligned, which is already opaque teeth, 10 teeth here. You can put this to the inside your table here, like this, okay, and then go to the mouse. You can put this in the mouse and let the patient bite, the patient smile, everything check, and also we can lower or upper this teeth, by changing this line upper and lower. All right, and also you can move this so you can determine the anterior posterior position of the teeth. All right, so once it determined, we can take this is the occlusal, actually occlusal plane, parallel to this occlusal table. This is just a reference. So you don't have to using this one. You can take it out. All right. You can take this out. All right. And using this impression material right here, like heavy body, and then you can make impression like this, right? So you don't have to be very accurate. And then there's impression there on the upper part. And then we can make the bite, registration, shear record, using this information, because we already know the vertical dimension. Okay, you can put it here, and then let the patient, we guide the CR position just in the vertical dimension. Okay, there's a CR record. Okay, we can take this out after the impression. You can put it here. Okay, and we see patient can see the mirror. You can check the smile, patient smile. Okay, and also we can make a CR record on top of it. All right, there's a the stopper, to determine the vertical dimension here, and then we put this share record material on it, and then we can get the bite restoration. All right, so this is how to use the SmileArch. It's very simple. and very accurate. You can get all information from this. I'll show how to use the SmileArch scan body. So there is the scan post on top of the MUA for MUA. So this is the MUA, the scan post. You can put this here. Okay, tighten up to 10 newtons just by hand. That's it. Don't tighten too much, only less than 10 newtons. Okay, tighten. And then this is the, just on top of the implant, you know, IT. You should have an implant. We have IT. Okay, this is the scan post for IT. So IT scan post. You can put this scan post on top of the implant, IT implants. All right, that's 10 newtons. 10 newtons. Okay, on top of this scan post, we can choose the scan bar, which is the longest and middle and short. Maybe you know you can using this longest one, like this, the posterior first. All right, posterior first. I can move up here. Okay, you don't have to tight too much, a little bit. All right, and another short one, the very accurate scanning. All right, so we better together, you know, close together, so that we scan these things at one shot. All right, so match the, all right, okay, now you can see the green color. Okay, that means, you know, it's already determine the implant position. Okay, then go to okay, in the middle, and go to the next one and try to scan this as part. Okay, now we get all 4 implants position. Remove the scan bar. I guess so. Sorry. So maybe this is 10 newtons, but this one is less than 10 newtons. All right. We scan this soft tissue. Okay. Go to next. On the soft tissue. So we have 2 data, the soft tissue data and implant data. We can match them together. Okay. Thank you.